Hello everyone and welcome to my channel. I'm your favorite medical microbiologist. I'm a seasoned and certified medical microbiologist, and I'm popularly known as the medical professional with the difference because I bring you knowledge on health and medicals and a lot more. If you're just joining this channel, don't forget to subscribe to join the family. And if you're a returning subscriber, I want to send you all my love and kisses. I love you. Let's roll in. Welcome back. In today's class, we're going to be looking at Purley penile papules, also known as hisutoid papillomas. Now, what are Purley penile papules, also known as PPP? They are tiny bumps, non-infectious or non-cancerous bumps that are found at the tip of a man's penis. Now, they are found mostly in men that are uncircumcised and in most black men. And this is a very important thing that a lot of men should note. They should be able to study their bodies. As a man, you should be able to take some time out and study your manhood to notice if there are any changes. And these are things that you need to teach your sons, your boys at puberty, that they should observe, themselves and notice if there are any changes. So we are going to now look at some important things you need to know about Purley penile papules. They appear after puberty and disappear as men get older. And they occur in 8 to 46% of men. It's not life-threatening and it shouldn't affect your sex life. Now, are there any symptoms of Purley penile papules? Now, there are no symptoms of Purley penile papules. They do not spread or change in shape, and they are not contagious, and they are not painful. They are smooth and they look like tiny bumps on thread. And sometimes they form 1 or 2 rows around the tip of a man's penis. Now, these are things you need to look out for as a male. If there are any discolorations on your penis, particularly at the tip of your penis, and these bumps begin to grow in size, or you experience any form of pain on your penis, you will need to see a urologist. A urologist is a doctor that is specialized in men's health, but you could also see your GP. Now let's go back. It's also good that you see your doctors so that it may be ruled out if it's an STD, a sexually transmitted disease, or a what. But you should also note, if you're experiencing pain while urinating, or there's any form of bleeding or any form of abnormal discharge or itches on your penis. These are things you have to note. Now, are there any preventions for Purley penile papules? No, there are no preventions, and there are no because there are no causes. There's no prevention because there's no cause. So, because everybody's lifestyle is different. Remember that any male that has Purley penile papules, it's not because you come from a particular race or you come from a particular, you live in a particular environment, or because you're uncircumcised or not. I just said it's more common in men that are uncircumcised and in men from the black race. That doesn't mean that Hispanics can have it. That doesn't mean that Caucasians can have it. That doesn't mean that men from Asia cannot have it. Now, one thing you should never do with penile papules is trying to pop them like a pimple, like an acne. It may actually cause an irritation, a bleeding, which if you're sexually active, it may start getting an infection. If you are so disturbed and uncomfortable with this PPP, I think you should see your urologist, and he will refer you to a surgeon where You'll be able to do some surgeries or some therapy that will be able to take out the PPP. But remember, this also comes with risk as well. You have risk of scarring, of getting keloids. If you're prone to keloids, you have a risk of infections and a lot more. But bear in mind that as you get older, as you reach like 40 years of age, or more, maybe you won't even notice it there. But it shouldn't affect your sex drive at all. It shouldn't. So if you have any questions in this class, do pop them down below. And I remain your seasoned and best medical professional, Gwendolyn Halley. Till next time, bye-bye.